Going fast. They get more. Yeah.
All right, ladies and gentlemen, welcome here. I congratulate all of you who are not getting soporific from your lunch blood sugar changing levels on you. Since that happens to all of us at one time. Can you hear me okay? I'm trying to get this microphone also so I don't blast you out. Let's see if we can get this one here. Okay, is that a little better there? Can you hear okay? All right, I just don't want to blast you out because that's really bad. Okay, Angela and I are very happy members of the Performance Healthcare Committee. And the whole reason for the Performance Healthcare Committee is to make sure that you guys can practice and play and enjoy your instruments until 2 seconds before you're in the grave. That's the name of the beast. And at the same time, some of you who do not have gray hair or had gray hair if it was intended, we want you to be able to do the same thing. So there's some groundwork you can lay that allow you to have long, happy, active, prosperous careers. That's the whole name of the game. So that's the reason for the committee. The NFA wants your dues for many years to come. Hey, you can only do it if you're playing. So to start out with, first of all, I'll give you a rundown because I don't play flute anywhere near as well as she can. So who is this guy? Why should I pay attention to him? Well, I've been treating musicians of one kind or another for over 40 years. I've been a member of the Performance Healthcare Committee back in the days when it was known as the Dysfunction Committee. You guys remember that one? Okay. that goes back a long way. I was lucky enough to be one of the founders and was the president of the Performing Arts Medicine Association, which is a good resource for you. If you Google it, the Performing Arts Medicine Association, they have resources that you can use as well, no matter what you do. I also happen to be married to a flutist, which needless to say got me dragged into it because I was a vocalist for crying out loud. In fact, she's playing tomorrow with her flute choir. And I've been singing for a long, long, long time. Believe it or not, I actually sang under the baton one time with Mitch Miller. He was short. His wife was tall. And like all you, I'm getting old. And I'm feeling it. So we're going to try and help you out a little bit in this regard, using some of my personal experience on it. Now, maturing definition. What is a mature flutist? Well, some of the youths around here are going to say we're deteriorating, which unfortunately is probably a certain degree of truth to it. Chronologically challenged also kind of goes. But it's inaccurate because when you age, that's inevitable. Whether you mature or not, that's a whole nother story. Now, sobering facts. Here it is. You grow old or you die, period. That's it, folks. There's any other choice. So all parts are going to wear down with time, whether it's on you or your car or your flute. People are no different than cars, except there's no good trade-in policy. And one of the, Bob Hope, my favorite, said, middle age is when you still believe you'll feel better in the morning. Now, one of the other truths about this happens to be on this little diagram here. And as we go through the years and through here, guess who? We rule, man. The population is climbing. There's more and more of us around because we don't refuse to drop dead as soon as we used to. So bear that in mind, is that we're a growing population here, and there's going to be a lot of us in this category. One of the problems we've run into is we have politicians who listen to actuarial people, and they keep telling us, hey, you know, you need to kind of raise retirement age and lower the Social Security age and maybe lower the amount of reimbursements you get from medical care because, quite frankly, we want to shove you off on an ice floe when you're over a certain age anyway and not give you any kind of long-term therapy. So there's a lot of pressures around there you need to be kind of aware of. The practical pressures, unfortunately, a lot of us, we kind of spent it as we got it. Okay, we weren't the wise ant. We were the grasshoppers. The wise ant is shoving the money away, And so poor planning when you're young sets you up for a pension plan. If you don't do it, guess what? You're going to be a greeter at Walmart. Poor rate of savings for Americans is pretty bad. A lot of easy credit, school loans. We'll talk about school loans. High debts, loans, credit cards, and then never getting debt-free with Dave Ramsey. So there are a lot of pressures on us to keep at it for a whole lot longer. Now, Social Security, if you count on only Social Security billing you out, good luck. You're going to be in a trailer someplace. So the U.S. hasn't got socials yet. We've got direct and indirect taxes increasing every year, which you are well aware of. The high cost of health insurance, if you're self-employed, that will get you. And I love Henny Youngman. When I told my doctor I couldn't afford an X-ray, he offered to touch up he offered to touch up my X-rays. Certain pressure about that one. Okay, so now the pleasure of it is you really enjoy it. This is fun. This is play. So you still enjoy the challenge. You still like to play. You don't want to be a geek in an office cubicle someplace, being a telemarketer, rattling somebody. It makes you special. You're different. To some way, you feel much better about yourself than maybe your neighbor does. And you can keep sounding impressive by dumbing down your repertoire. Hey, it's easy. So it's like moving from the blue tees to the red tees in golf. You can do this. And one of my favorite violinists, Mishy Elman, you know, the critics never change. I'm still getting the same notices I got as a child. They tell me I play very well for my age. So man's got to know his limitations. All right, so what are the details of what you can expect when you age? And how is this going to impact your flute playing? What can I do now if I'm younger, like those in the back row? And what should I have done in the past? What can I do now that I'm having problems besides just wailing and gnashing my teeth about it? All right, ugly details. Fingers, wrists, shoulders, back, hips, feet, neck, brain, nervous system, lungs, teeth, jaw, eyesight, hearing are all adversely affected by age.
Oh my God.
And the activities of our youth. So you can always look back and say, ooh, I shouldn't have done that. So no man is rich enough to buy back his past. So what are we going to do? Well, we know as far as bone and joint disorders, arthritis, about 60% of the population is going to be symptomatic by the age of 65. And it accounts for about a quarter of all the primary care doctor visits. Oh, I heard. All right. Arthur, okay. Women comprise 60% of the cases is probably because you guys actually go to the doctor. They got these data. For the rest of us, just sit and bellyache and have a beer. Okay, the incidence goes up with age, and it gets worse with excessive weight, gets worse with hormone changes like menopause, which I don't have, thank you, lack of exercise, repetitive injuries in the joints. And unfortunately, the flutists are usually 3 for 4 out of these factors. So you're stuck, guys. All right, so what do you do for them? Well, you avoid unnecessary joint trauma. I would not recommend picking up handball. Use non-injurious practice and exercise methods, which we'll be covering for you. Treat any hormonal abnormalities you have. Your anti-inflammatory medicines may slow the permanent damage. It's not a panacea. But for those who have something degenerative like rheumatoid arthritis, if you catch it early and suppress it down, it's a whole lot better than trying to play catch up with it. Keep your weight down, exercise early, smart, and forever. Okay? I don't care if you've got a walker, a knee brace, and you're stooped over, the exercise will still do you good. All right, muscle atrophy. There's a nasty word called sarcopenia, which means a gradual decrease in the ability to maintain skeletal muscle function, that's these guys, okay, and mass. Associated with aging, but unfortunately, they don't really know for sure what causes it. It can be slowed by exercise, but you need to start exercising early to minimize the looming permanent muscle loss. So the sooner you start on it, the better you are. If all of a sudden you turn 70, you're going, oh, I think I'm going to start doing this. You'll get some benefit out of it, nowhere near as much. It's kind of like when you put the money in the pension plan. It's a whole lot better if you started 20 years ago than it is if you suddenly do it now. So getting older is no problem. You just have to live longer. I like Groucho Marx. He had a good idea. All right, posture. there is no proof that bad posture is unavoidable, okay? So doing it makes a difference, and you'll hear more about that from a lot of people. It requires more work to prevent it, though. The muscles get weak, and the discs between the vertebrae shrink. Anybody gotten shorter when you go to the doctor? Yeah, okay. That's not your fault. That's that little space between each one of those bones gets smaller, and you sort of stack on down. Kind of like your Oreos are getting closer. You get less cream between the Oreos. Okay? So practice good posture early and keep it up. Remember, Quasimodo was a percussionist. He wasn't a flutist, so you've no obligation to be like Hunchback of Notre Dame. At this particular point, I'm going to give you a neuromuscular break. And we're going to get into some of the practical stuff you get into. Yay!
Everybody hear me okay? So one of the things he actually just said was it's not, what did he say about posture? Like no proof that bad posture is unavoidable. And the whole thing about sarcopenia, there's something that I learned in one of my certifications that they said that the symptoms of old age are exactly the same as the symptoms of disuse. Move it or lose it, here we go. So that's me, and the word salad after my name means I do a lot of fitness stuff. And the last one is cancer. SFS is a senior fitness specialization that I got a little while back, and the cancer is a new one. So being unhealthy is expensive. So the sicker you are, the more you go to the doctor, the more you have bills, blah, 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 right? So the American Association for Retired Persons and the Administration on Aging report that in 2006, only 39% of older people rated their health as excellent or very good. That's not very good. So more than 85% of older adults suffer from at least one chronic health condition. And in 2005, this accounted for 57% of the nation's total healthcare expenditures. It's very expensive. Those expenditures totaled $362 billion and averaged $12,566 for every older adult. So we're talking about Medicare, and it's kind of naive to expect that Medicare can handle that. So what can we do? We can prevent that. So why should older adults strength train? This is a fun one. I'm going to say that at least a third of my clients are over 60. And I have a favorite. I told her before I came here that I was going to use her as an example, and hopefully she didn't mind. She's grinned at me. She's 65, and she came to see me for early onset osteopenia, which is the precursor to osteoporosis. And she just had a bone density scan that told her that she was losing bone mass, and she didn't like that. Precursor to this. This woman is a toothpick. Her legs are about the size of my arms. I mean, she is tiny, tiny. And she's like, I need to strength train so I can grow my bone mass and get stronger and not, break a hip and fall and things. And I went, okay. So we've been training for 3 years. She can deadlift at least 85 pounds, which is probably what she weighs. She can row this way, 70 pounds, which is astounding. I mean, she can't pick it up, but she can move it. It's amazing. And she just had her bone density scan, and it showed no progression of the osteopenia whatsoever. So take that with a grain of salt. Resistance training programs can include physiologic changes that result in a variety of strength adaptations. So a well-designed resistance training program can delay physiologic degeneration and produce optimal neuromuscular efficiency. Blah, 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 blah. All that means is there's really good things that happen when you strength train. Besides just muscles and just bones, you also get better insulin sensitivity, which decreases as your metabolism slows down, and all those other fun things that go with aging. So in short, you delay aging and its effects. That's pretty simple. So then the benefits to adaptive strength training. All of these good things. Lots of stuff. We get decreased body fat, which we all need, right? Increased bone density, increased neuromuscular control, endurance, strength, and power. And all of those things are really great for flute players, actually. Does anybody notice that as you get older, you can't play for as long? Things start to hurt a little more often in your playing sessions. You have to cut them a little shorter, take more frequent breaks. Strength training can actually help with that. So you also have cardiovascular exercise benefits. I'm not going to read all those to you. Hopefully you can read them. But maybe we should walk them this way. I don't know. So a fun one, decreased brain lesions is actually a benefit. So anybody ever heard of MS? They've shown that more cardiovascular exercise will actually decrease brain lesions, increase mental alertness. Have you ever been running? I haven't. I hate running. I don't run. So have you ever been walking, biking, swimming, and all of a sudden you get all these ideas in your brain? That's the effect of all that oxygen coming to your brain, and it helps with things. Same thing when you're in the shower. Blood vessels dilate. You get great ideas. You can't write it down because you're in the shower. It's really, both of those are really kind of annoying, but helpful. And so we've got some guidelines for your cardiorespiratory training. So if you're not exercising regularly, you don't want to be like, okay, I'm going to go get healthy. I'm just going to go every single day, 7 days a week, 30 minutes to an hour. That will not work. It's also a very bad idea. So you wouldn't do that if you're not going to cram for an audition, right? Well, we do, but we know better, right? You know better. So we're not going to do that, but you shouldn't do that with exercise either. The slow and steady approach is the best. This is the same thing. So if you're not exercising regularly, you want to start with maybe 8 to 10 minutes of light to somewhat hard perceived exertion. You've heard of the RPE scale as the rate of perceived exertion. So you've got from light to ridiculous, basically. And you want to be somewhere on the lower end of that. In all the books that I've studied, it's really vague, believe it or not. It's not like a blood pressure is this and heart rate is this. It's like, do you feel like you could carry on a conversation okay? Oh, you're probably all right. I mean, it's about that vague. So it's nothing hard and fast about that. So you want to work up to 30 to 60 minutes of continuous exercise followed by a 5-minute lighter cool down. This is about cardiovascular, cardiorespiratory training. So we're talking going for a walk. We're talking swimming. We are talking getting back and forth to the convention hall, back and forth from the, from the exhibit hall all the way to your room and back. You do that circuit about 6 times. You've hit that today. So when you can maintain that heart rate for 30 minutes and say, it's going to take you a while. If you're not exercising regularly, you start out with 10 minutes a day, perfect. When you get up to 30 minutes and you can maintain a higher heart rate for about that long, 2 to 3 times a week, then you progress to intervals. We've heard of what interval training is, and you can do interval training with weights. You don't have to do it necessarily by walking faster. That might not even be an option for you. Recumbent bikes are great. If you're already lifting, lift weights faster. That's my favorite way to tell my clients, well, what do you do for cardio? I lift weights faster. That works. It gets your heart rate up. So this is going to be adequate for most adults, but if you're a cardio stud, there's some more intervals that you can do. But basically, intervals, you do a 5-minute warm-up, and you get your heart rate up to where you perceive it as difficult. And then you come back down for twice as long. So think like a minute followed by 2 minutes, or 3 minutes followed by 5 minutes, something like that. So flexibility training, this is one of our favorites, isn't it? Because as you get older, you get a little less mobile. Your range of motion gets less. You ever notice this? So when you've got different tools here, we have SMR, static stretching, and dynamic stretching, which are all fun, basic terms for SMR is self-myofascial release. Anybody ever had a massage? Not your favorite thing? Well, for most people, some people not so much. But SMR is where you do it yourself. So I've got some fun tools here that I can show you what we can do with that. You can use a foam roller, you can use a lacrosse ball, you can use one of those fun little vibration gun things that you see, all kinds of stuff. But what you're looking for tender points. You're looking for things that have gotten stiff. So my favorite one, using a foam roller. And if you've never used this, there are some contraindications to this. If you are in the older population, you don't want to use a foam roller if you have osteopenia or osteoporosis, if you have varicose veins, if you are obese, anything like that, okay? So definitely, it's not a one size fits all, but one of my favorite ways to use this is on your upper back, because how often do we go backwards in daily life? We go forwards a lot, right? We eat, we sit, we train, we play, we type, we drive. We don't do anything back here, right? So using this on your upper back is a fantastic way to get some mobility in your thoracic spine. And you can use it for rotational stuff too. We'll get that in a minute. So you release what's tight and then you static stretch. So then you're going to stretch it out, and then dynamic stretching, you're going to put it through its full range of motion. And you get some neuromuscular re-education, which is a fancy word for my brain thinks my muscle is this long. Now it's actually this long. Now my brain knows it's this long, and it's going to use that full range of motion because it's like a cycle of disuse. You're seeing this. You ever gotten an injury and you move less because you know that if you do this, it hurts. So then you start to do that, and pretty soon you move less and less and less and less. You can reverse that. It's exact opposite of that. Oh, something to note. I notice this a lot of my older clients. If you're static stretching, do not bounce. So say you're stretching out your calf. Okay? You're doing this, you're doing this, doing this. Don't do that. Please don't do that. You could cause massive problems if you do that. So just relax into it, hold, think about lunch. I don't know, anything. Okay, so we've got some flexibility training examples. Things to know when you are older population. You want to start on the ground, start on a stable surface. So a lot of people, when they get a trainer, their trainers get all gung-ho and excited to get them exercises, and they've got them balancing on BOSU balls and lifting weights on unstable surfaces, and my brain just goes, oh my gosh, these poor people are going to fall and break a hip, and it's their first day. Don't always start on a stable surface, and then you move to unstable. And also, if you're, who here actually trains balance on a regular basis?
Yoga.
Awesome. I'm so glad to see that, because if you don't train balance, you lose it. My clients who are 30 years old and younger, they can't stand on one foot anymore because they don't. So what I like to tell people is, even if you're not training with me, you can work on your balance all the time. Stand on one foot while you're brushing your teeth, while you're washing the dishes, while you're typing at a stand-up desk, while you're brushing your hair. Yes, ma'am.
What do you think about Tai Chi? I know it's helped my balance a lot.
Tai Chi is fantastic. Yes, absolutely. Tai Chi, yoga, all those things that put you through slow ranges of motion that force you to work on your balance and your proprioception and your core strength. Those are all extremely viable options. Totally recommend that. So SMR, these are some examples of this. Has anybody ever seen this before? I know a couple of you saw this before. That's a Theracane. This is its goofy looking older brother called a Body Back Buddy. You can get this on Amazon for like $30, something like that. And it's got all these great little knobby things that you can put in places that hurt. And the reason you put it in a place that hurts is so that you can get that muscle to relax. It's just the same as trigger point massage, but you're gonna do it yourself. Okay? So, neck mobility. This is a fun one. This is an area that we have a lot of problems with, right? I'm gonna guide you through this. And you do not have to do this. So, I'm gonna put this through. If this hurts, can you guys still hear me okay? If this hurts, don't do it. If it feels unstable, don't do it. When in doubt, don't do it. But for some people, this is one of their favorite things. So no way but to know, but to try. So if you are if you're sitting and you're able to grasp the left side of your chair, hold on to the left side of your chair. If you're not able to grasp the left side of your chair, just put your hand out behind your low back. Okay? Everybody, if you've got your hand behind your low back, I want you to pull your shoulder towards the ground. Everybody else who's gripping your chair, just hold it and lean to the side just a little bit. So you should feel a stretch through here, yes? Everybody look straight ahead, and you're gonna take your right ear and bring it towards your right shoulder, and then come back. It's not something you wanna hold for a long time. And then come back, and go forward. And you should feel a nice stretch. If you feel it here, check the angle of your head and make sure you're not looking a different direction. So you're gonna pull down and pull this way, okay? So to get your SCM, which is a muscle that when we turn this way to play, that's the muscle that turns your head right here. We need to stretch that. You can keep in the same direction. What they're doing, we're gonna do the same thing. So you take the right hand, put it on the side of your head, maybe above your left eye, and you're gonna pull down with your left, look up diagonally, bring your right ear towards your right shoulder, and ever so gently push just slightly against your fingers. 3, 2, 1, and relax. And you should be able, every time you do that, to stretch that a little farther. If you don't feel it here, you might have to finagle around with the angle a little bit, but that's what that is, okay? Okay, so these are some common problems that you see with flute players and desk jockeys and truck drivers and everybody else. Any of these look familiar? So this one right here, upper cross syndrome. There's your Quasimodo right there, is your percussion guy. Yeah. So this is why we call it upper cross, because it makes a cross. So these are short and tight, and these are weak. So these are the things that we need to strengthen. These are the things we need to release. Okay? Another one is lower cross syndrome, which is this right here that you've heard of, an anterior pelvic tilt, which is a big fancy term for my pelvis is tilting to the front, and now I got the J-Lo booty going on. This is not good. So, I mean, some people think it's good, but for functional purposes, it's not really a positive thing. So when you have an anterior pelvic tilt, guess what shuts off? This doesn't work. This doesn't work. This is overworking. Sound familiar? And then your hamstrings are tight. Oh, I need to stretch my hamstrings. They're probably overstretched and you should leave them alone. So what we need to stretch are hip flexors, and that was over this one. Oops, go back. That was here. That's how you stretch your hip flexors in the front. If you think this J-Lo booty problem is going on for you, that's one of the ways that you can stretch it for you. And then so then you're gonna activate your rear end, activate your core, and suddenly everything pulls back in alignment, is working the way it's supposed to, and guess what? Your shoulders probably feel better too. And a third one, does this look familiar? Anybody seen this guy before? Is this anybody in this room? It's me. The hip guy. So yeah, I see this a lot, especially flute players, because what do we do with the right side? Kind of business, stand on one. Does anybody notice you stand on your left foot a little more when you play? Hike your hip, then your other legs do in this business? Yep. So a lot of people I see have this. This is a very common pattern. I see this an awful lot. And dysfunction can start in the feet, it can start in the hips, it can start anywhere it travels. But that's why you don't train one area of the body. Just because you're a flutist doesn't mean you're not gonna, that you need to do other things in here, because the body works as a whole. It doesn't work in isolation. So what to do about it? Those are some things we talked about. You're always gonna stretch and then you're gonna strengthen. You can't do them in the opposite order. You can't force a muscle to strengthen if it's being overtaken by a stronger one. We have to release it first. So we've got a neck alignment exercise. Real quick, here we go. You're gonna put your hand on the back of your head, right? You're gonna tuck your chin into your throat, is what it says. How I want you to think about, pretend like your chin is on rails and you're going straight back. And you should feel a push into the back of your hand. If you feel like you're pushing up, you're doing it the wrong way. Straight back. You can also put your hand right on the front of your neck. And if you feel those muscles tighten, you're also not doing it correctly. These should be easy and relaxed. This is way easier to do if you're on the ground. But you go straight back and suddenly your ears are over your shoulders, and that's where you're supposed to be, believe it or not. But you get that forward head posture, this feels normal. Does anybody notice you feel different down in here too? And your shoulders feel a little more open? So you press your top of your head up into the sky, lengthen the spine, and gaze at the horizon. If you're gazing in any other direction, it's not going to work quite right. So we call this chin tucks, and that's one really great way to strengthen those deep neck flexors that get tight when you do this, which is a big problem as we get older. So back to balance training, Tai Chi, yoga, all those great things. The shortening of tendons and ligaments reduces joint range of motion by as much as 25%, while cross-linking leads to stiffness. We all know this. You don't move, you don't move. You move, you continue to move, right? So stability is an important training adaptation because it increases the ability of the kinetic chain to stabilize lumbopelvic hip complex and joint stern movement. This is all basic stuff. It's just a fancy way to say it. So here's some scary stats. Anybody worry about falling? We hear this all the time. Falling and I can't get up? Legit though. 1/3 of adults over the age of 65 experience an accidental fall each year. 1/3. That's a lot of people. And this one scared me. If an older adult does not sustain a serious injury as a result of a fall, many develop a fear of falling again. Anybody had this happen? Which limits physical and social activities. And then more than 18 million emergency room treatments in 2004 alone, 16,000 deaths from fall injuries in 2005. And this is scary. Approximately 25% of older adults will die within a year of sustaining a hip injury due to a fall. You don't think about that when you see kids running around, they fall, you go, aw, you don't think about it. But has anybody here fallen as an adult? I have, and it scares the ever living daylights out of you. It's just like, this is okay. So this is why balance training is a really important thing. So balance training, what and how? Train your core. You've heard this before. So what is your core? Your core is everything but your head, your arms, and your legs, okay? We were talking about stand on one foot. My favorite way. It's not just to stand on one foot, because if you stand on one foot, you're probably going to do this business. This is not activating anything other than my sense of sass, I think. Not really activating a whole lot, right? So what you're going to do, and that's right here, you see that the arch is lifted upwards. When was the last time you ever thought about your arch of your foot? Unless you're wearing orthotics, right? Or unless it hurts. Yeah, so right here. So this is what I tell my clients. You can do this while you're sitting here. If you can put your feet flat on the ground and you can lift that arch, you're already way ahead. If not, you might have to try rolling out your feet and squeezing your toes and see if you can get that feeling of, oh, where's my arch? Sometimes you might have to have someone press on it. You want to lift that arch upwards. And then when you put your hands on your hips, you lean to one side, you stand on one foot, you don't have to come all the way up here. You just barely off the ground. Don't lock your knees, but lift that arch and squeeze here. And suddenly, this is a lot harder than it seems. So try doing that while you're maybe not brushing your teeth. Maybe picking out clothes for the day. So you can brace yourself in the doorway just in case. Because you always want to practice your balance training where you've got safety precautions until you get really good at it. Okay, so here's the last of it. We've got a few things left. Strength training. This is what I do. This is why we're here, right? So you always want to make sure you have proper form. And those couple things are, you want to brace, that feeling of someone's going to punch you. What'd you do? You go, you feel that all the way around, right? You wouldn't go, because they'd punch you in the face. That wouldn't really work. You just, okay, that's what bracing is. You always do that. You keep your shoulders back and down, which again is exactly the opposite of what we do all the time. Back and down, and you keep your feet straight. When's the last time you paid attention when you were walking if your feet do this or not? You seen anybody walk like this before? Guess what happens here? It's a lot harder to stand straight. But if I'm walking with my feet straight, it's a lot easier to do that. So pay attention to that if you haven't. And these are all some guidelines, whether you're working with a trainer or not. If you want to start, you keep those things for form, and you always start with static stretching, follow with your core moves, and then you add in strength. If you do it the opposite, it might not work so well. And you always start with less and progress to more, just like with everything else. Just like with balance training, just like with adding money to your 401k, just like all the other things. You start slow, and you get fast. Okay, so we have a few other things. So the other things to worry about, we've got diabetes, arthritis, cardiovascular disease, cancer, stroke. Those are all things to take into consideration. You want to make sure if you're with a trainer, make sure they're aware of all that, because that's huge information for them to have. So these are just some things that to be aware of. If you have any of those things, cancer, if you've been prescribed a sleeve, please wear it. Lymphedema is a huge deal. You have high blood pressure. Make sure you use caution with isometrics, which is where you're pushing against something that's not pushing back against you. Don't hold your breath, and don't lift any cars starting out, okay? Just take it easy. If you have diabetes, this is a big one. Peripheral neuropathy, we've heard of this, and retinopathy. You want to take frequent breaks, have well-fitting footwear, take balance precautions, and monitor your blood glucose before and after. Very important. So if you have neuropathy, you want to make sure that your trainer is aware of that, and you don't want to do anything that's going to put you in a compromising position if you can't feel your feet. Arthritis, this is a big one. Lots of people have arthritis. Do not stay in a fixed joint position. In other words, you need to move, okay? But you don't want to, you want to have smooth, controlled motions, no jerking. So I'm sorry, CrossFit's probably not going to be for you. That's just probably just going to out with that. Olympic lifting, unless you've been doing it your whole life, probably also going to say that. If any exercise causes pain in the joint, stop immediately and regress. So another thing with arthritis, you don't want to do a ton of anything. So if anything says start with 20 repetitions with weight, take that down to about 10, okay? Shoulder impingement, anybody have this? This is a big one for flute players, right? It's vital to stretch the chest and avoid any kind of overhead pressing. You don't need any of that. You need pulling down, not pressing up. Okay? Osteoporosis, engage in high load lifting. In other words, lift heavy stuff where you fatigue at about 6 to 8 reps. So this is the one where you need to be picking up heavy stuff with good form on the regular. That will build some bone. You can also do some vibration plates, maybe a little bit. Jumping, plyometrics are great, but with an older population, it's probably better to start under the supervision of someone that will make sure you land properly. All right, so we're almost done. We'll give it back to Dr. Steve here. But what can flutists do that's the best? Rows. Rows, planks, anything that will strengthen your butt on the opposite side of your arm, your tricep extensions. And if in doubt and you don't know, just focus on the back of your body. You don't probably need to be doing push-ups. You don't need to be doing bicep curls. You for sure don't need to be doing any kind of pushing. So what do we do here? We need to do the opposite, okay? Exercises to avoid, all those things I just said, bench presses, chest presses, anything you're gonna see in, bodybuilding magazines, probably not the best place to start out. Sit-ups, not a good move, not a good move. Planks are way better. In fact, if you wanna, they did a study on military soldiers preparing for their PT test, and they had some of them work on sit-ups and they had some of them work on planks. And the planks showed that they were just as effective, if not more so, in increasing their sit-up ability without having to do sit-ups. Water breaks? Planks. Planks are,
planks?
what are planks?
That's the question.
Yes. There you go. Nan is demonstrating a beautiful plank. Lovely job. That's good for overall core strength. So here's some things. If you want to try this on your own, you can do them with your arms directly underneath. You can do them with your arms straight, but you want them directly underneath your shoulders, okay? You brace your elbow, you brace your abs, you squeeze your butt. So it's like this. You can do this actually. You can do this against a wall. You can do this on a countertop. So the goal is that we don't have any of this. We don't have any of this or this. Your spine should always be in neutral. So a plank is gonna be where your body is in neutral, okay? Squeeze your rear end and squeeze your shoulders down, and my body should look more or less straight. If you are the other way, you can do it this way, and that's a little bit harder. So I would start with on the wall and work your way down. The important thing is that you keep tight here and here, and that will help with core strength. It's just vital to everything. It's vital to proprioception, it's vital to balance, it's vital to overall core strength. Also, avoid anything with weight on an unstable surface. This is what I was talking about. Don't be this guy. Don't hire somebody who tells you to do this. You fire them immediately, okay? Call me instead. Okay, so don't be this guy. And if it feels scary or wrong, don't do it. Back to Dr. Steve. Oh, yes, sir.
One question for you on strength training. What do you think of using exercise bands?
Oh, they're perfect. And I brought a whole bunch of them. We just don't have time to go over it now. Yeah, exercise bands are fantastic. Yes.
Would you suggest for anybody who's been idle, not exercising at all, start with water aerobics first?
Water aerobics are fantastic. That's also an excellent viable option. I would think in addition to that, you can do that. And if you have the opportunity to use some weights and some bands, you should also incorporate those because it's a little bit different. But yeah, that's great.
What is that?
Oh, that's called the Body Back Buddy. Yes, ma'am.
Also, and you know those noodles that people use?
Whole noodles.
Yeah.
Yeah.
If you use it long ways and put it up against your spine,
Yes.
it helps fix those muscles.
It absolutely does. Yeah, you can lay lengthwise on it and go back like this, and that will stretch everything on the front of your body. I think that's excellent.
Oh, hey. Now, she ain't done yet, trust me. I'm going to be zipping along here, so we'll have plenty of time for questions. I also want to put in a thank you for Chris Mayo for making the exhibit hall so far away from Tower 2, because it's probably helping a lot of you out more than you might think. Pretty much also for those, how many of you are feeling like you're drinking from a fire hose, getting all this stuff? All right, or got writer's cramp? I have something for you. In this little envelope right here, there is some typing exercise for you. It is a link to a Google Drive, and on that Google Drive will allow you to access a PDF file of this entire talk.
Yay.
So everything is on there. You don't need to remember a dadgum thing. You just have to be able to not mess up zeros for O's, and it's horrendous to do it, but it's all there. So, and also you get a freebie on it because you also get the hearing talk an hour ago. So you get a twofer. All right. Let me spend a little time here on those of you who still have a brain and nervous system after going through a couple of days here. One of the things that goes on here is a steady decline in some of our cognitive, our thinking skills, which starts in the 30s. See, you're not over it. Starts in the 30s, and we get more problems with new memories as we get older. In other words, you can remember what you had for breakfast 2 years ago, but not what you had this morning. And sometimes it makes it harder for you to try and learn new material or memorize new phrases. With increasing age, the occurrence of the jaw reflex right through here gets reduced. The amplitude is decreased, and it has to do with the general age-related changes in the muscular tissue, the sense organs, the peripheral nerves, and especially the central nervous system. Problem is, this means your ability to do fast runs gets worse. This is where you have to maybe consider changing your repertoire a bit. What to do for the brain and the nerves? It turns out that you can do something. First of all, keep the brain mentally active. You exercise your brain like you do your muscle. The old lose it, use it or lose it applies here. And so if you start not exercising and staying involved in things, and this is one of the first things I worry about people who sometimes retire, is they end up losing their focus on things. And next thing you know, they, just like a falling leaf. You don't want that. Keep emotional links active to other people. Do not become a hermit and sit there with a TV set and a six-pack. Avoid alcohol. It can, yes, I know, I like to have a glass of wine now too, but you gotta be careful with it because it can kill brain cells, destroy nerve function, cause tremors, and most importantly, cause falls. And you already heard, is with a fall, okay, you fall, you break your hip, you might as well count on having a 4-shot revolver with 1 bullet in the chamber and going click. 25% chance that you're going to go bang. All right? This is that serious. So bear in mind that's important. Aggressively treat the diabetes and vascular disease you heard about because that affects how well your nerves. And if you can't feel your feet, you can't feel where you're going down the step. Next thing you know, you're down on the ground again. Never smoke. These clog the blood vessels that carry the only oxygen your nerves receive. Once they're dead, they're gone for good. They don't come back. There's no decent recovery function for brain cells. Hand and finger. We know that hand function decreases with age with both men and women, especially after the age of 65. All right. Deterioration of hand function in the elderly population is to a large degree secondary to age-related degenerative changes in the musculoskeletal, vascular, and nervous system. So again, some of those you can slow down. You can't always make them go away. What to do for your hands and fingers? Well, you avoid unnecessary injury. Those of you who are playing rugby at your age, don't. Avoid overuse, misuse when practicing. Ergonomically match your instrument, chair, music stand, and computer to the person, namely you, okay? If you are forcing yourself to hunch over like this at the computer screen, I would strongly advise standing up or doing whatever you can to keep your good posture, doing everything you possibly can, getting the right kind of chair, even if you have to bring the chair with you for your rehearsals. Persistent pain is bad. Don't think being macho is smart by saying, oh, it didn't hurt, I can put up with that. So find the cause and fix it. The pain is something telling you something is wrong. Pay attention to it. If injured, RICE. Now you're going to hear this a lot. Everybody remember RICE? Okay. Rest, ice, compression, elevation. It's not perfect, but it's the next best thing for most everybody until you can seek other kind of attention. It's always a good thing to kind of bear in mind. What you do is you reduce your activity, splint the injury, keep your weight off of it, put ice packs on it for 20 minutes. I wouldn't go much more than that because you can get ice burn with it. Compress it, put some ice wrap or something like that on it, elevate it so it's higher than your heart. And again, if it lasts longer than a day or so, you may need to see somebody about it if it's not getting any better. Respiratory function. Several factors alter the mechanical function of the lung with age. And as wind players, guess what? You got a problem that the pianists don't. So you have a decrease in power due to fewer muscle fibers and a decreased mechanical advantage. The lung gets stiffer, which means it can't expand quite as much. You also get tightness of the lungs, tightness of the chest wall stiffens, and then if you got the bad posture on top of that, you're really hosed. One of the things that the singers found out is that singers used to make a big deal about, well, you have to breathe from the diaphragm. That's a bunch of baloney. The diaphragm's a thin muscle that separates the guts from the lungs, and it doesn't have the power to do much of anything. And another person talking about, well, you need a muscle strong enough that you can push a grand piano with it. I was also stupid. It turns out that's not the muscle that makes you breathe deep either. It's these guys in the back, these big guys in the back. That's what the professional singers and the professional musicians actually breathe with. And can you do it with the bad posture we're talking about? No. Can you do it while you're sitting in the car? No. Can you do it with a bad chair? No. Okay. So this is all very important. So you got to milk out everything you can and not give yourself an automatic disadvantage. Okay, what to do about the lung? Don't smoke. Although I have to admit, it did put my daughter through college. So smokers, I thank all the smokers for paying her tuition, but for you guys, she's already graduated, so I don't have to worry about it. Avoid pollution if you can. Those of you who are living in NYC, I'm sorry, can't help you there. Diet, watch your diet. Okay, the high fruit and vegetable intakes have been most consistently associated with protective benefits in terms of the visual problems, cataracts, respiratory disease, and cancer such as breast, stomach, and colon rectal. Deep breathing we've talked about, yoga, tai chi, etc. Treat your asthma with a maintenance medicine to avoid your rescue medicines. Now, anybody run into someone with asthma, the big thing with asthma is they've got two branches. You got maintenance and rescue. If you can use the maintenance medicine so you never need the rescue, that's what you want to do. Okay, you want to the rescue. You got to be rescued. You got to breathe, but you want to do everything right so you don't have to use it anymore than you have to, because the injuries to the lung tissue is already starting to take place when you have to use a rescue. Embouchure. Oh, we got lip plates, we got undercup lip plates, we got all sorts of things for embouchures. However, if you ain't got no teeth, you got problems. So, status of your teeth and gums is mainly dependent on how well they're cared for in the preceding decades. Okay? Floss them now or toss them later. So, take care of them. The problem with dentures is they don't have any feedback. You don't have any sensory feedback with the denture like you do with a tooth. And now the other thing that happens is your mouth gets dry. Anybody got a dry mouth? Yeah, okay, join the crowd. Because the problem is the number of glands we have to make the moisture have cut down a little bit, number one. Number two, every medicine you can possibly take for every possible medical condition causes dry mouth. I don't care if it's antihistamine, hypertension medicine, a medicine for a neuromuscular condition, you name it, you get dry mouth. In addition, your tongue and lips move slower. They just can't do the fast motion quite as fast. So what do you do about it? Well, floss and brush like Mama told you to. Keep your own teeth, even if it costs more. It used to be a big thing. Oh, the tooth of color problem is going to cost me $1,000 to get the thing repaired, and it's going to cost you 50 cents to get yanked out of the dental school. Keep the tooth. All right. More water, less Dr. Pepper. Anything other than water, you're probably going to pee too much, which is embarrassing on stage. There's a stuff called biotin and some of its buddies. It's a good medicine to have. It causes more lubrication. I like it. I use it a lot. It helps with people who've got Sjogren's disease, where your mouth gets really dry with that. And this guy who's 110 said, if I had known I was going to live this long, I would have taken better care of myself. I like him. He's a good guy. All right, aging eyes. I'm sorry, these boys are getting older too. You're less likely to produce as many tears. The retinas get thin and have a risk of detachment. The lenses gradually turn a little yellowish and become less clear. So if you think your music is getting yellow with age, it might not be the music. Okay. And when you get in your 40s, you find focusing on objects that are up close may become a little more difficult. Either that or your arms are getting shorter. You know, you just can't quite get it out through there a little bit, and you find you're needing new glasses. So the irises will stiffen, and your pupils get less reactive to light and more difficult to adapt to different changing of light. You also find yourself getting very sensitive to glare, particularly when driving at night, or with bad stage lighting. How many people have been on stage and the lights are awful? Yeah, can't see squat. You're looking at it like going like this, and you can't see it. You're changing, you're cursing at the stage manager for the instrument light, and you're paying $180 for a new light because you can't see. Well, part of it's the eyeballs. Cataracts, glaucoma, macular degeneration are most common problems of aging eyes, which means you need to pay the bucks to have your ophthalmologist actually put those stupid drops in your eyes and dilate them where you're blind as a dadgum bat trying to drive home in order to keep an eye on the back of your eyeball to make sure things are okay. Also, good luck reading the handwritten 30-second notes on some of the scores you get. I don't know you, but boy, those, forget it. All right, what do you do about it? Well, regular eye exams to catch it early. Don't smoke, increasing your ocular pressure. More light needed to read by, okay? You're gonna have to have more light. You're gonna have to bitch at the stage manager, get the lights turned up a little bit louder. You're gonna have to get a good lighting system for your light. You'll find that in some situations you probably can't see. Okay, everybody else can, but you can't. And it's just to do the lighting. Different eyeglasses. It turns out that you may find yourself having a real collection of eyeglasses. Okay, you get your eyeglasses when you're on stage in the music stand. You get your eyeglasses when you're working the piano. You're going to have them all over the place and label them because you'll need different ones to do the job. Don't waste your money on the bogus, the Bates eye exercises. Oh, I got to massage my eyeballs and I got to do away with my vision problems. Golly gee. Forget it. You're wasting your time and money. And keep them well lubricated. So you're going to have lots of artificial tears. And you'll be like me. I have my little drop of Sustain eye drops right on my nightstand, and as soon as the alarm goes off, I'm feeling around for it, so I put my eye drops in before I do anything. That's even before my first cup of coffee. Okay, vital. Have those little things and keep them around with you all the time. Any of you ever been to Aspen or some of those nice little places like that? Dry eyes, dry mouth, dry everything. Okay. Hearing loss. I talked about it for about an hour beforehand, and I'm going to go through it real fast because it is going to be in that little website. Hearing loss is distortion, tinnitus, or ringing in the ears where you think you hear a bell and it ain't a bell. Wax infections of the ears. So if you don't get it, just I'm easy to find. voicedoctor@hotmail.com, and I'm in the book. About 1 in 3 over the age of 60, you've got significant hearing loss. Okay. 2 out of 3 you don't, but 1 out of 3, that's pretty bad. It's worse if you got any vascular disease, any history of noise exposure, certain medications will mess you up, and if you did a bad job of selecting your parents. So if you got family history, sometimes that would knock you out as well. Injury in orchestra players is likely, but unfortunately it's difficult to prove. And so there's a big fight for a long time as to orchestra players trying to get compensation for a job-related hearing loss. Is going to be a big fight for a long time, and the only people who are going to make any money on it are the lawyers. Okay, what to do about possible hearing loss? So first of all, I tell everybody, get a baseline hearing test. I would ideally recommend that any person who's serious about their music, somewhere even before they go to college, the music school, get a baseline hearing test and keep it around. And the reason why is the only way, if you have a catastrophic event where all of a sudden you say, I really can't hear much at all, and you go and get a hearing test, sometimes they won't be able to tell if it's how long it's been there. But if you got this audiogram and you say, here's where I was, here's where I am now, and they go, ooh, that is a big change. Okay. And we know this for a fact for for EKGs or cardiograms. Anybody goes in the ER and says, I'm coming, Elizabeth, I got a heart pain in through here. If you got an EKG, they can tell right away if you have a fresh heart attack. If you don't, sometimes they're not sure. So have one around. If any of your friends or family start bitching at you, time to get your ears checked, okay? Avoid any unnecessary loud noises, iPods, concert, lawnmowers, power tools. Hearing protection every chance. And I don't care the brand, but ER20s, Max Hi-Fi earplugs, Shooter's earmuffs, whatever you want. You want to keep the sound waves from getting to the eardrum. If you keep forgetting the eardrum, you're probably not going to have as much trouble. Hearing aids, if needed, but the problem is you're going to need a lot of adjustments to get it right, okay? Hearing aids are not like going and getting a one-stop shop. As a matter of fact, if you have hearing aids, you need somebody who's willing to have you come back 3, 4, 5 times as necessary to make adjustments on them, and you may need to bring your flute with you so they know how to adjust the thing, because you will not be an easy fit. You'll be a wonderful fit once you got it fitted properly. And you may, it doesn't even matter what the cost of the hearing aid. Some of you need a really super duper one, some don't. If you get a blast, immediate noise, okay, you're in the wrong place, wrong time, you happen to be in the front row of the aging Rolling Stones concert and something goes wrong with the microphone and you get blasted. and you come out of there and you can't hear thunder. And your ears are ringing like crazy. You wake up the next morning and you still can't hear thunder and your ears are plastic. Get away from all noise. Rest, no stress. This is an over-the-counter medicine, N-acetylcysteine. It's cheap. And what you do is you start, and there's variable doses. They've had anywhere from, they've cut the dose down since I made the slide. It's now 600 milligrams twice a day for about 2 weeks is what they're saying now. And that seems to be maybe some help. And they're either in terms of reducing the hearing loss or in terms of reducing the ringing in the ears. We know it virtually does no harm whatsoever. But it seems to stabilize these free radicals in the oxygen that are starting to screw up the inner ear aspect on it. They did a lot of work on it in the Navy, sticking these poor sailors in a submarine with loud noise for a long time and seeing what happened to them. If it's no good, there was wait about a day or two. But if you don't notice it's improving, this is an emergency to go talk to your doctor about. Okay, and literally when you call on the phone and say, I have an emergency. I have sudden sensory nerve hearing loss in my ear. Now, if they don't see you within a day or so, you probably need to go talk to somebody else, because there is a type of therapy that you can get that stands a high probability of reversing that hearing loss. Now, it's not fun. You're going to take a bunch of steroid pills. You'll be awake, bright-eyed, and bushy-tailed for about 3 days, and they're going to give you maybe a shot through your eardrum.
Oh, God.
Now, they're doing it with a microscope. They're looking down there. They're numbing up the eardrums so you don't feel anything. The needle is smaller than one that you use for getting a TB skin test with, and they float the steroid and it goes right on one of the windows and gets absorbed into your inner ear. Virtually no pain at all with it. But the success rate on bringing back hearing that's been severely damaged is remarkable. But if you wait 2 weeks, worthless. It's gone. So that's why you got to jump on it. Something to bear in mind. Hopefully you'll never have to have it. Ringing in the ears, common after age 40. It's due to the hair cell being injured, frequently due to noise. But you can get the vascular disease, high blood pressure, stiffening of the arteries. Meniere's disease is a special case with a different treatment, which I won't go into because that'll take way too long for you guys. But tinnitus, you can see if they're here, is a high presence. Up around, in males, we really get toasted. Sorry about that. Women, you get scot-free for a while, then you catch up to us and exceed us. But it's mostly, we assume it's because of the occupational exposure that a lot of the men have in industry. But around age 65, off the charts, pretty high up there. So you can kind of count on it. What to do about it? Use noise protection. White noise sometimes can drown out some of the background noise, reduce your stress. Stimulants will make it worse. Coffee, tea, Coke, Pepsi, Mountain Dew makes it worse. Biofeedback and hypnosis may help. The N-acetylcysteine may help, although I'm not so sure about that. And for people who are really being driven nuts, like Pete Townsend from The Who, he has incapacitating tinnitus with this. And you can get a special kind of hearing aid that actually pumps in a certain amount of background masking noise, and that can help tremendously for people who are about ready to jump off a cliff because of it. Wax, as the ear canal skin ages and dries, it sheds more dead skin cells. Ear wax get reduced in number and effectiveness with time. And so the block, and so a lot of people as they get older, they're constantly going in, can you clean my ears out? Can you clean my ears out? I got wax in here, I can't get it out. And they get more ear infections as a result of it. And so that is something you have to do. So what do you do about it? Well, first of all, keep the car keys out of the ear. There's somebody out there who puts that car key in the ear. I see the guilty looks from here. Okay. Keep the Q-tips out. The Q-tips are the same diameter as the ear canal, which means it's like a ramrod or muzzler. Pack this thing in here a little tighter. So if you're going to do anything, you use a little mineral oil. It will help soften it up. You can use swimmer's ear drop, which is basically half vinegar and half rubbing alcohol. And that'll hurt. It's good for kids when your grandkids get out of the pool. You use a wax softener, any type with a bulb syringe to wash it out. You'll gross out your spouse because they see the stuff coming out into there. And once you've done it, use a hair dryer in low setting and blow dry your ear and get the water out. It works well. If all else fails, you can see an ENT doctor. I see people coming in every 2 months, like clockwork. Oh, it's time to clean your ears out because we got microscopes and suction equipment. And it goes back. It's really gross, but really it works great. Okay, stress. Most medical problems are worsened by stress. Stress. Do not stress. One of the nicest things about the exercise programs we're talking about is it tends to reduce stress. So that's another reason I like it. At the BAPAM survey, it's British Performing Arts Medicine, they found from covering 65 worldwide orchestras showed stress was serious problems with instrumentals. So, what are the top 10 stress markers? All right, money words. Hey, you guys aren't paid. Okay, making mistakes when performing. Medical problems affecting your work performance. It hurts. Okay, incompatible stand partner. Disorganized rehearsal time. Illegible music. All right. Playing an orchestral solo. Having problems with your instrument. Instant leak. An incompetent conductor. And a conductor who saps your confidence. Okay. 73% of these people had moderate to severe stress from working with a conductor who sapped their confidence. 73%. 61% had severe to moderate stress with incompetent conductors. And I always like this one. The definition of an assistant conductor was a mouse trying to become a rat. You've never encountered that, have you? No. All right. There is no such thing as separation of mind and body. There isn't. Forget about it. They're linked. They're in the same person. The very molecules in our bodies are responsible to our psychological environments. Okay? It's linked. If you're headed for trouble, try prayer, meditation, yoga, exercise, any other stress-reducing factor you can. For those who fail, see your doctor for professional help. You do not want to be trying to live with stress. Your life will be nowhere near as good as it could be. So, I know a man who gave up smoking, drinking, sex, and rich food. He was healthy right up until the day he killed himself. I always like Johnny Carson for that one. And age is strictly a case of mind over matter. If you don't mind, it doesn't matter. So that's, both of them lived to their 80s. Bear that in mind, okay? You can live quality even if you've got a lot of problems. So for the young flutist from a West Virginia coffee lunch counter, don't criticize the coffee. You may be old and weak yourself someday. And with that, we will open it up for questions for you. Yes.
With the balance exercises,
Yeah.
I've noticed that if I do that standing on one foot, it's okay. But if I close my eyes, it's a whole different feel.
Don't close your eyes.
Yeah.
Don't do that.
That's right.
Yeah, we actually had a competition once, just standing around in combat boots waiting for a parade once, and we're all bored because, you know, they make us stand there, and we're like, I bet you can just stand on one foot. We're like, I bet, who can stand on one foot the longest closing their eyes? I was like, God damn. Yeah, combat boots are not great for that. But you want to see people fall and break a nose real fast, close your eyes. Don't do it.
No, I'm not supposed to do that.
No, because you'll hurt yourself. It's a stress test. And neurologists are basically diabolical people anyway. But that's one of the tests that neurologists used to see how good some of the balance was. If they come in like this, hey, pretty good. Let's make it harder for them. Oh, let's make it even harder for them. And then, hey, let's close your eyes. And so you keep doing it until the person falls into like a lump of jello and bangs his throat. But it is a stress test, and we don't want you stressing it because that one forward history of you pushing up daisies.
If you want to challenge your balance, there's plenty of ways to do it. You can start with standing on one foot, and then you can move yourself around a little bit more. You can lean. You can start picking up things. You can do all kinds of stuff. You can hop from one foot so you can stick it. All kinds of things that don't involve closing your eyes. Yeah.
And Angela, are you still an Army flutist?
I am still an Army flutist, 15 and a half years.
Is the
Huh?
exercise that you have in the military good for you?
I wouldn't answer that because I'm 20 year retired Navy.
It's kind of hard to say because I'm National Guard and we do a little bit different. And so the stuff that they're having us do now is mostly when we go to schools, and it's completely different. They're teaching us how to do preparatory stuff, which will avoid injury. And the new PT test that they've been trying to come out with 10 years might be coming up. And it's actually way better than the standard push up, run, sit kind of stuff. So, but I'm not involved in it right now, so I couldn't tell you.
I have a question. Ordinary osteoarthritis that I've got, things are getting really stiff. And I'm taking my ibuprofen. Is that my waist?
No. She has osteoarthritis, which makes her hands stiff, and she's wondering if the ibuprofen wastes your money. The answer is no, it doesn't waste your money. It can help. You want to take the weakest thing you can, and actually the ibuprofen is about as good as anything. Aspirin works great, but the problem is you get ringing ears and you get ulcer in the stomach and it thins your blood out and everything else. Tylenol is kind of wussy, and so the ibuprofen is much better from that standpoint. The other thing that actually helps the best, and I've been doing this for my wife for 25 years, is we get one of these little rice bags, okay, nuke it in the morning. So I get up in the morning, stumble off and start making the coffee. I take the rice bag, put it in the microwave, cook it for about a minute and a half, come on back and place it in her hands. And she's just nuzzled up in her fingers. By the time she gets up after 20 minutes of that, her fingers are doing great. And no drug, but it works perfectly. And we've been doing that for 20, 25 years. It's great. Pardon? She grips it, holds the hand, moves around.
Anything that's an anti-inflammatory that helps you could maybe order anti-inflammatory foods that can help, like coconut oil and turmeric and cherries and pineapple, all those things. And I mean, it's just really good to, plus lots of water.
Yeah.
That's all extra helpful.
Water. And actually, that's the important thing is that I can't begin to tell you the number of conditions that are worsened because you don't get enough water, and can be improved if you get enough water in there.
You need at least half your body weight in ounces a day as a baseline. You weigh 200 pounds, 100 ounces of water.
And it's sometimes more so in people who are wind players and singers because you're mouth breathing. And guess what happens when you mouth breathe? You can't use God's humidifier, and it dries up more and more and more. Yeah.
One caution on the anti-inflammatory stuff, as a long-time user of those, who has had to stop, long-term use can have an effect on your kidneys.
Yes, it can, especially Tylenol. Tylenol can really nail it, but ibuprofen can as well. So you have to watch that and make sure your family doctor works with you, particularly if you got reduced renal function.
So is ibuprofen or Botox,
They're cousins. Basically, they're what we call NASMs, non-steroidal anti-inflammatory drugs. And so the NASMs, you get your Advil and you get your Aleve and your Naproxen and all. And then you get into the COX-2 inhibitors, which would be your Celebrex and what have you. But basically, they're non-steroidal drugs, and they're all kind of close to one another. Yeah.
You're talking about the rice.
It helps. It helps. The problem with rheumatoid arthritis is there's another factor involved, which is where part of the body hates the other part's guts. And you get this inflammatory chewing up process going on. And so you need more than that. Although you don't want to mess it up, you don't want to bang it and hurt it anymore. But a lot of times you're having to deal with other types of medicines to suppress this inflammatory reaction that's actually destroying the joint. Yeah.
Getting back to this question, I was wondering about what's going on in the brain when you have your eyes closed versus open?
Okay. It has to do with proprioception input. In other words, when you have your balance like this, your body is relying upon the way the sensors in the feet are telling you are, and how much weight is on this foot, how much weight is this foot, is an even floor, whether or not your inner ears are telling you, are you starting to kind of lean off this way too far or this way too far? And your eyes are an additional source of input that tells you where you are in relation to the horizon. And so you're taking all of these things in toto to try to keep yourself balanced by alternating how much weight you're putting on each muscle group to keep you vertical, which is a very difficult, complex process to do. And so once you take away one of those, now you've got 2 out of 3 trying to keep you balanced. Just like if you're trying to stand on a mattress, now all of a sudden you've only got 2 out of 3, but you're losing the proprioception. Or if you've got neuropathy due to diabetes, you lost the proprioception to there, and you're more likely to fall on over because you have no idea that you're starting to go over the side except for what your ears are telling you.
And does that get worse through the years? I've kind of noticed that.
Well, it's not that you close your eyes and makes it worse. It's just that it's part of the team. You lost one of the boys on the teeter-totter. One of them left off and you go off to one side. You need to work together. Yeah.
Oh, good. Angela, you had a slide up there. You talked about releasing the lower back.
Yes, ma'am.
But what did you say to do?
I didn't. Good call. So there's a couple different things that you can do. I was talking about the lower cross syndrome where this kind of business goes
Yeah,
on.
something like that.
To release the lower back, there's a couple things that you can do. And when it comes to SMR and using a foam roller, you can use a foam roller on your rear end. You can come see me at the Performance Health Committee booth or anywhere, and I will show you how to do this. You can use a lacrosse ball in those areas. A lot of times your low back is tight because something else is weak and it's forcing it to do the work. So releasing your piriformis in your butt sounds funny, but you roll on that muscle, release it, roll your hip flexors and stretch those. Really what's helpful is any kind of glute strengthening exercises. So doing bridges, that's my absolute favorite. And then strengthening your deep core muscles, your TDA, your transverse abdominis. Planks are good for that. Doing dead bugs, there's all kinds of things I can show you that these two working together will help alleviate the stress on your low back. So it's a lot of times the site of pain is not the source of pain, and that's usually one of those.
Thank you.
Mm-hmm. Yes, ma'am.
I've got a couple of trigger fingers, and I'm wondering if you have anything to say about that.
Ooh, yeah. Trigger finger is no fun. Matter of fact, you spoke right at the time. My wife just got trigger finger. Got 2 trigger fingers about 6 months ago. Went into an orthopedic hand surgeon, gave her 2 injections into her hand of a steroid, and within 48 hours it was gone. And so the reason is the problem is that when you're moving your finger like this, but the gizmo that actually allows you to move is actually your hand up through here. And so what's happening, you've got a little tendon going through a little tunnel, and what happens is that one of them is too small or too big, and it's not going through very well. It goes partway through, boom, and it slips on through. And so by getting rid of that swelling there, you can decrease it, and most of the time you can decrease it without surgery. And so that's what you want to do. And so far she's doing great with it, but you can get to the point where the steroid injections aren't working anymore, and then the hand surgeon goes in, makes a little incision, slits that sheath, and most of the time, if you got a really good hand surgeon, it's gone, it's fixed. That's all there is to it. You will never get anymore. Yeah. But that's trigger finger. And so it's actually a problem of the size of the tendon and the size of the sheath. But it's very easy to fix. Yeah, well, anything, because what happens is when you practice too much, things swell. And so that's where that gets aggravated by. Electric scissors are really nice. Okay. Okay, yes.
My question has to do with drinking the water.
Yep.
My wife always tells me I don't drink enough water.
Our wives always tell us we don't drink enough water.
Wait a minute. But no, wait. If I drink more water, I'm going to be running to bed. But she's telling me if I drink enough water long enough, I'm not going to be running to bed. I'm actually going to help in the long run.
The answer is you will have to listen to your wife. What happens is with time, your body will acclimate to this new water input. And it won't happen right away. In other words, yes, when you first start doing it, increase your water intake dramatically, you're going to feel like a Kentucky Derby racehorse. But what happens is after a while, your body will equilibrate. So that's why I recommend when people are increasing their water, they do gradually. You know, just don't flood yourself, because first of all, you get sick. But you kind of plot out literally on a table, and over a period of about a month, start increasing the amount of water you get in, and you space it out. I don't like the idea of getting, a big gulp and getting it all in at one thing. So you spread it out, so every hour or so you get more in throughout the day. And you'll be much less likely to overtax your renal system and overtax your bladder and make yourself sick. And you can also make yourself dizzy. If you drink too much water, you get water toxicity. So you want to kind of ease into the thing. And we all have, basically after the age of 40, you want to do everything gradually. But yeah, you will equilibrate, and you will find that you will not have to be like those commercials on TV where the person's standing in line going to the restroom in the middle of the concert. Okay, it will work.
I have a lot of problem. We do long 2-hour practice sessions for flute flyers, and we stand the whole time. And so we're locked here, and then my back hurts because of breathing. Is there something we can do to help us?
So her question is that she has long 2-hour long rehearsal sessions that just go on and on and on, and then she gets back pain, and she gets neck pain, and she gets pain, and then hard to breathe after that.
Yeah.
Right. So what's happening is that as muscles get taxed, other muscles take over. So you get these muscle compensations because the body is an amazing thing that it will keep doing until it completely fails. So pain is just an indication that you've got an overcompensation going on. And at this point, your body's telling you need to stop playing. You need to rest. You've got an overcompensation. Doesn't mean that you're going to be able to. So, I mean, telling the director, look, every 20 minutes, whatever, you have to do what's right for you, obviously. So I keep a lacrosse ball in my bag. And some of the things that flute players deal with, you get tight muscles in your chest, which causes your back to hurt. Like I said, the site of pain, not the source of pain. Your chest isn't going to hurt. Your back can spasm because it's being pulled this way, which this is like, hey, I go this way. And you're like, no, I have to play, so it gets stuck, basically. So the more you can release this and the more you can activate this, the more in balance you're going to be. But the more that dysfunctional pattern happens, the more other muscles are going to take over. Your serratus anterior is going to take over. Your other muscles are going to take over when your core is not strong enough. So your breathing muscles, your scalenes, all those things that help out, they're now being recruited as primary function instead of secondary assisters. So now they are having to pick which job they have to do. So basically just an overall strengthening program of getting out of those muscle imbalances will help. But in the meantime, taking breaks as much as you can. And
So say you have a minute before you have to start the next one. Is there like or?
it really depends on kind of what the problem is. I will be going over some of those in my presentation on Sunday with Amy Lee Carr and everybody else. But you can do a chest exercise, a stretch, and I can show you that here in a little bit if you like. And that's one that I would always do. I always roll here and I stretch here. And then I'll do some prone Ys just like this to strengthen this, and then I go on about my day. And in the middle of it, maybe doing some chin tucks, that kind of thing can help. Bracing, any chance you get. So brace here and get your arches to lift, and all of that will help reinforce your brain like, oh, this has to work together as a whole. It's not just me doing this and hoping for the best. Yes, ma'am. It's Sunday at 11, I think. Yes, ma'am.
When you're working out, is there anything you recommend other than water to keep yourself hydrated? Is there like some kind of performance drink that would be good?
You can always take some electrolytes as long as you don't have any contraindications for that. I like some Noon tablets or, electrolyte fizz or whatever, as long as there's nothing in there that will counterbalance that or counteract that, I should say. But water is great. Coconut water, some people like that. Some people don't. I like water. Yes, ma'am.
I have 2 students that are older and they have locking fingers. Is there anything you can do for that?
Like double jointed fingers where they kind of,
They
go.
They just kind of.
Dystonia?
No, so like
No,
they
it's
kind of,
just-
like where they get that weird kind of double jointed-ish where the fingers do weird things.
Yeah, they just can't.
I have a couple of students with that as well.
Keep it curved. They just.
Right, so they have hypermobility and hyperflexibility of the fingers. This way, like this? Does it look like that?
Yeah.
Yeah. Yeah.
double jointed.
That creeps me out. Oh my gosh. Well, you might ask her is there anything that you do before I answer?
I used to have a problem when I was a kid, and it just eventually with hand
Worked itself
position,
out?
Worked itself out. I really don't have that problem now.
I was
Right.
told to keep this
Yeah.
very firm when I have a light touch.
Yeah.
But I'm not doing that because then you get stuck. I have to keep them rounded.
Right, keeping a rounded seat position can help, and the thumb placement can help.
Pretty firm.
Right.
My touch is like
That might be something that Lee Pearson can help out with changing where your fingers and body mapping and Alexander, all that stuff about tension and where your tension is. The other thing that has really helped my students, there's something called Silver Ring Splint Company. Have you heard of this? You guys seen this? They're beautiful. They make these beautiful rings. They're great for arthritis. Girl had them when I was in high school. And I'm like, oh, those are pretty. She goes, oh, I have to have those. I said, why? She goes, it prevents my fingers from flying backwards when I play too fast. It's like, what? So yeah, it's really like it covers here and here and it connects at the joint underneath and it prevents that hyperextension. So they can't do that. Silver Ring Splint Company or something like that. There's nobody in here till 5, but if you guys need to go, we totally understand. Yes, ma'am. Yes.
I've got a question.
Sure.
You mentioned, I've got osteoporosis and I've had since I was 31.
Let's go.
And I took loads of medicine for many more years and they didn't allow. They finally gave me like the brain and now it's that so you mentioned like that little that roll.
The foam roller, yeah.
I use that all the time.
Good.
But you just mentioned that wasn't good for osteoporosis, but it keeps the tooth out of the head.
It does. Right, that's a general contraindication basically. So it may or may not be okay for you, and it also depends on where you use it. So if you've got, right. Right, so if somebody say they're rolling on their hips and they have to put their arm down and their bones in their arm are weak, they can snap and you don't want that. But it doesn't mean you can't foam roll, it's just something to be careful of. Yes.
I'm getting really weight at the bottom.
Good.
And their first suggestion, and I'm just hearing it, his suggestion now was bench weights, and I think I understood.
Oh, bench pressing with a barbell or being on a bench and doing stuff? That's different. That's totally different. That's fine. That's
Yeah,
fine.
because I was really excited about.
No, that's fine. That's fine. You're fine. And these are all general things that I was saying. This is not a nobody can do this. It's more of a blanket. I do. You can find me my website. This is my website here, musicstrong.com. I'm updating my website. My web guy quit, and so I'm trying to fix it, what he didn't do. So bear with me there. But I'm on Facebook constantly. It's facebook.com/musicstrong and Instagram and all those things. But it's Music Strong. Yes, you can find me. Yes.
Years ago, I joined Cardiovascular, I saw a musician who did finger exercises and then got good at it, so he did.
I just found out about him 2 weeks ago.
And so, I've been doing that. And I do this. Does that do anything or am I just like,
Do you feel better?
It's not like you're, you're using balance in positions. But what I do it is that it brings lots of people to small muscles. Is that good?
Definitely not bad.
It's good. And what you're doing a couple things. You're doing range of motion exercises, which means you're keeping the flexibility in there. Okay, which is number one. Number two is your brain is being wired to doing this kind of motion and doing it in repetition, which means you get faster, and doing it in different sequences. And a lot of people will do a little gymnastics where they'll kind of have their fingers dance 1 to 3, 1 to 3, 1 to 3, and doing different scales. You can actually do practice scales doing your fingers this way. And there's nothing wrong with doing that because yes, you are increasing the oxygenation to it. You're increasing the blood flow. You're increasing range of motion, and you're wiring this. Because when you're really playing, you're almost playing with your spinal cord. You know, it's almost like a reflex. And so if you build those reflexes in, you know, it's like Captain Gobert with no noise.
Well, we should probably end this early to go, but you can see it afterwards. I have a newsletter if anybody would like to sign up for the free newsletter, and I can send you resources and all kinds of things. So, yeah, you can sign up early.
And by the same token, let the healthcare committee know, through your emails after. Is there anything you want to hear for next year?
Yes, please.
Because we're always listening for what you need. What do you need to hear? What do you need to learn? And group will respond. All right, thank you very much.
On her laptop?
Thank you. That was good. Oh, you're welcome. I have a question.
Is that the?
Yeah.
Where would the last one? Send it to you.
Yeah. And I know that it's worse when I just.
Yes. Thanks, Facebook. Bye.